Good morning, ladies and gentlemen, and thank you very much for inviting me to speak in this occasion. I'm Paola Barbino, the Chief Executive Officer of Alzheimer Disease International. I'm going to share my screen for a presentation, which hopefully is going to appear on your screens as well in a minute. Today I'm going to speak about dementia strategy in Lithuania, why we need it, as it was asked by Dementia Lithuania, which I thank for inviting me to speak today. Let me tell you something about ADI. We were established in 1984. We are the umbrella organization of 105 Alzheimer's and dementia associations around the world. We represent our members at the WHO, the UN, OECD, G7, G20, and many other bodies. Promoter of the World Alzheimer's Month. We are also the publisher of the World Alzheimer's Report. And our vision is prevention, care, and inclusion today, because we're hoping for a cure tomorrow. It's getting closer, but it's not quite there yet for everybody. Let me tell you something about the global impact of dementia. Every 3 seconds, someone in the world develops dementia, and the total estimated annual worldwide cost is over 1.3 trillion at the moment. This figure is forecasted to rise to 2.8 trillion by 2030. So these are huge sums, as you can imagine. The estimated growth in number of people with dementia is of 55 million today and growing to 139 million in 2050. But let me tell you something about Lithuania, because you'll be more interested in that. So currently, we predict that there are 56,000 people living with dementia in Lithuania, but this number is expected to increase to over 81,000 by 2050. So as you can see, a very steep increase. This is due to the fact that there are more people, of course, as well as the fact that more people are living longer, which is a good thing. And dementia, unfortunately, is now diagnosed also at a much younger age. And this is due to increased techniques in diagnostics, of course. So these numbers are surprising even us by how fast and how rapidly are they swelling. But my plea to you today is that we really should be looking at implementing an action plan in Lithuania. So dementia is a complex disease. There are, for a start, 104 ways to develop dementia. Alzheimer's is the most common, just so that you know what we are talking about. And in 2017, with the WHO, we obtained a global action plan, which was fantastic. However, despite all countries under signing it, including Lithuania, this is still to be implemented. The plan is complex, but very effective. It includes all those 7 areas that you can see here, making dementia a public health priority, the friendliness, the inclusiveness of society towards people living with the disease, the important issue of risk reduction, dementia diagnosis, treatment, care, and support. Diagnosis is becoming a big issue now that there are treatments on the horizon. The support for dementia carers who often suffer of physical and mental issues whilst caring for a person living with dementia without support. The importance of creating information systems for dementia. We need to monitor, we need to know incidence and prevalence, and research and innovation. Many people don't do that. I'll have a slide later telling you why it's important for each country to go into that. So why national dementia plans, to sum it up? Because it's important to know whether you have the capacity to do diagnosis and post-diagnostic support. For example, do you even know how many neurologists, geriatricians, psychiatrists there are that can diagnose the disease? You need also to train your healthcare professional at primary level. In our survey in 2019, we realized that 62% of healthcare professionals still think dementia is caused by aging. And dementia is not caused by aging. It's a disease. A brain of someone that has it is very different from the brain of someone that is healthy. So this is important to train your healthcare professionals. It's also important to convey stigma, risk reduction. I'll talk about it in a minute. And then again, be prepared for drug breakthrough and have an idea of how many people have it in your country. So basically, the plans provide the framework, enable an efficient and concerted whole of society approach. It allows you to put budgets And this also protects the budgets from changes of government, government change, as you know. And it's important the budget stay, because otherwise you are going to have governments that don't look after this issue. And this issue is never going to go away. So once you do a plan, it's important to protect it with allocated budgets. And again, it's important to look at the whole of society approach, because dementia is such a complex disease. All 7 areas are important, but for example, some nations, they prioritize their work in research. It's important research because we are learning more and more that it's important to focus on your population. For example, advice on healthy eating to reduce the risk of dementia would only make sense to Lithuanian citizens if their own diet were to be studied. It's not good to tell people you need a Mediterranean diet. I'm Mediterranean, but there isn't such a thing as a Mediterranean diet, because each nation, in my country, Italy, actually have a very different diet. So it's important to look at localized issues. Conversely, when research on diet is being implemented, there must be mechanisms in place to use that information to inform society on how improvements to that diet can reduce their risk. So there's no good to keep research in university if you don't tell your people what to do about it. There are also other areas. For example, there are advances in genetic studies where the genome of a specific population can play a part in its cure. If you don't take part in this kind of research, you may be doing your population a disservice. Let me tell you something about this year's World Alzheimer's Month. This campaign this year is on risk reduction, explaining that it is never too early and never too late to take action. There is recent evidence that suggests that up to 40% of cases of dementia can be delayed or reduced by focusing on 12 modifiable risk factors. And we will aim this year to raise awareness of this issue. We are doing a report on this issue and will provide recommendations for people and governments on how to reduce risk. Can I please invite you to have a look at that? You may already have risk reduction campaigns for other non-communicable diseases. It is paramount, really important that you include some of the factors that focus on dementia. And some of them are typical only of dementia. For example, not to be socially isolated. For example, to keep your brain active. And these factors, hearing, this is another one, wearing your hearing aids. A lot of people don't know that. So you really should try and include these factors in any public health campaigning. Every year we campaign on one area, but we've also campaigned in various other areas. For example, last year it was post-diagnostic support. 2 years ago it was diagnosis. By working with us to amplify this message, you can use a ready-made campaign that only needs distribution. We do all the work for you with some of the best PR agency in the world, and you really only need to use that. We have had confirmation this year that 2 very big nations are using our material for their campaign. So we are hoping to have a lot more people taking part in World Alzheimer's Month this year. And this also ensures that the government of Lithuania is compliant with some of the obligation to action area 2 of the Global Dementia Action Plan. So you also would be fulfilling your multilateral agreements. So my call to action today: Lithuania does not have a national dementia plan. A plan is the only way to be prepared and help Lithuanian citizens most effectively. We urge the government of Lithuania to develop and implement a national dementia plan, and we at ADI stand ready to be helpful to you if you need it with Dementia Lithuania, to really help your citizens live a better life living with dementia and a better life for their family. Thank you so much for listening to me, and I hope that we will be seeing each other in person soon. Have a great day. Goodbye.